So, Kelley, tell us how come biofilm grows so well in dental water lines.
Yeah, so like I said, even when life is normal in even the busiest dental practices, uh, dental water lines are the perfect place for bacteria to grow. They sit stagnant the water sits stagnant at room temperature for several hours of the day, right? And so you can go to the next slide. They're less like rivers like this, and they're more like this. And it's sad to say, like, no one wants to think like I'm squirting pond water in my patient's mouth, right? But the fact of the matter is that it is, they sit stagnant. And so it's so important to treat, because the biofilm grows so fast within just 1 week. You can be using 100% distilled water, and within 1 week, you can have over 200,000 colony-forming units of bacteria if you're not using some sort of low-level bacteria or antimicrobial. I'm sorry. And biofilm is stubborn. And Mike, you do way better job at explaining this than I do.
No one does. But maybe Mary. Mary could talk about it. But the short answer is, yeah, biofilm's job is to go forth and multiply, right? So its job is to attach, and then its job is to detach, and it detaches within days to weeks. What that means is every time we use an air water syringe, we squirt it for 3 seconds, the biofilm goes downstream a couple of feet, and then it reattaches and grows another colony, and it's the perfect petri dish. Now, most of this stuff, we can drink it all day, every day, because it is non-pathogenic. But if there's enough of it, that means the conditions are appropriate for certain pathogens to grow. Not COVID, but Pseudomonas, Legionella, and this new one, Mycobacterium abscessus. Pretty nasty. So that's the reason that we need to treat our water lines.
Yeah. And I always like to think about it like a dandelion. So this is just kind of an analogy for me. Just like Mike was explaining how the biofilm, it attaches, and then its job is to detach, go downstream, and reattach. So it's like blowing on a dandelion. When you blow on a dandelion, it spreads the seeds kind of around, growing. Then dandelions grow everywhere. With biofilm, same thing. When you use that air water syringe, it's just pushing that biofilm down, and it's at random times, like it can slough off, break off in chunks, roll off. It's just super, super complex. But this is just a good analogy of how the biofilm just goes downstream, reattaches, and then just starts growing again.